Thank you for that. I think these short introductions give us all a flavor for what each of these organizations is doing and how they're looking at the potential of shared value and in some cases implementing it within their organizations. One of the things that I really wanted the panelists to talk about is the rationale or the reasoning behind the approaches they've taken. And Mehmood touched on this a bit by saying that you saw it as necessary to grow your business and sustain growth. Lori, you also touched on it a little bit. But for those two panelists and the others, I'd be really interested, and I think the audience would be interested to understand, what was your rationale for going in the direction you did? What value did you see in making the shift to shared value? And for those who have not embraced shared value and are perhaps doing something different, what were the reasons for that? What were the limitations that you saw around shared value that caused you to go in a different direction? Nancy, why don't we start with you?
Sure. Both of the entities that I work with are basically family companies. And one of the things I've always been struck by, if you look at the tradition of giving in companies and shared value, is many of them are family-owned companies, UPS, Dell, Lauder, Mac. And in both of those instances, the families went into basically particularly around health. In AIDS, our company was founded by two gay men in Canada whose friends were dying, essentially. And they created this, actually before cause-related marketing, the Viva Glam campaign, which is 100% of the selling price of this product line goes to the foundation. Well, the company is now a $3 billion, Mac is a $3 billion brand, and so we raised $50 million. And so it was never a program that was sort of started after. It was started at the very beginning. It was part of the DNA of the company, and I think honestly part of the special sauce. And retrospectively, what we see now is, if you look at the data from Cohn or Edelman, is people care about this stuff, particularly millennials. I think actually all of us care about this stuff, but those of us who aren't millennials sort of convinced ourselves we could only care on the weekends. And what we're seeing now is that people are expressing their values in what they buy and what they don't buy. And that has become a huge driver. The other pieces that are, if you look at our data, we have the highest employee retention rate of any luxury cosmetic company. And for us, that means real dollars because we put a lot of money into training. And one of the top 3 reasons people always list for staying at Mac is the Mac AIDS Fund. So we've seen real business value. I mean, I think in terms of, and we've seen the same data at Lauder. I guess my question is, and we talked a little bit about this at lunch, is the shared value piece, I think, is how, as Kyle is saying, is how do you operationalize this? Because I sit in meetings all day long with people who, like, for instance, rent space and travel retail in airports. How do I make a decision as a business person for myself, my unit, or for the company as to whether they should give more money through the Mac AIDS Fund or whether they should go for that travel retail space that's better? And that business person can then quantify the increased value to the company. So I think one of the things I think I would love the field to evolve, to have much more concrete business discussions about how you actually implement and execute, honestly, on this work. The other is, I wonder, shared value, honestly, is a term that I would never use in a business discussion in my company or brand, not because people don't care, but because people have no idea what it means. So I guess one question is, in calling it shared value, are we isolating it? Should we just call it value? I mean, and maybe in our own thinking, in groups like this, we can talk about shared value. But is it really just plain value? And if it isn't just plain value, is it somehow less than other value? Because at the end of the day, most of us, including me, we work for shareholder companies. And, Leonard Lauder once said to me, we all work awfully hard for you to give all that money away. I said, I know, Mr. Lauder, I really appreciate that, Mr. Lauder. At the same time, the man just gave almost his entire house to the Whitney Museum. So he obviously does deeply care about this. But I think that one thing that I would just encourage us is to really hold ourselves to the highest level of business rigor and not sort of mainstream ourselves, not create a whole separate thought that we're then in 5 years going to have to try and reintegrate into regular value discussions.
Sure. First of all, as we looked at our global health, thank you. As we looked at our global health engagement, and we've always believed that a global pharmaceutical company has a a responsibility that goes beyond just what we believe is our basic noble work of developing new medicines and bringing them to the world, that we have a responsibility beyond that to those who can't traditionally access our medicines in the ordinary course. So being involved in global health is something that is just part of who we are, and I think that's true of all of the multinational pharmaceutical companies. But our major global health initiative, as I said, really didn't have any relationship to our current business. We had been a very big anti-infectives company. We're a big antibiotics company, but we had exited that business more than 15, as we sit here today now, more than 15 years ago, and really are totally a non-communicable diseases company focusing on cancer and diabetes and other NCDs. And so the reason we were sustaining this this other program around multi-drug resistant tuberculosis was out of sort of a moral commitment, because we were exiting the manufacture of a couple of drugs that we would have left the world without had we just exited them. So we transferred the major part of that money I said we spent was a huge transfer of technology to multiple companies in 4 different countries where the highest incidence of multi-drug resistant tuberculosis is. This involved a few people in our company who were assigned to do this work. Many, many years of commitment, lots of money, but ultimately didn't engage our employees at all. So when you went on the, as I was being recruited by Lilly, I went on the website first thing. First thing that pops out at me is this article about, or this piece on our multi-drug resistant tuberculosis work. I get inside the company and nobody knows what it is, beyond what they've read in the website. So we believe that going into something that was part of our business, that also made a difference for society beyond just our regular work, would engage our employees more. It would be more sustainable because this is what we know, this is what we care about. If we can make some money, at least in the long term, or at least there's a prospect of making some money out of this, it will make sure that it survives, my tenure, our CEO's tenure, other people who are very interested in it. So we thought it would be more long-term sustainable. We could bring resources to the problem beyond just money. We had relatively few resources we could bring to things that are outside of our business area, except writing a big check for them. To be able to bring our people resources, almost 100 years of history with diabetes. We were the first company to bring insulin to the world back in the early 1920s. We could help our business in the long term. So sort of the pure business reason behind it. And then finally, we knew that the global health world was moving in the direction of non-communicable diseases, as we're all aware, and that by engaging in global health around non-communicable diseases, we not only would be where kind of the global health world was going, but also there would be a defensive benefit to that as well, where, as things started to evolve, if people, wanted to encourage us, for example, to just give our medicines away or dramatically change the pricing of our medicines, we thought it was important to be at the table engaged in that discussion rather than being on the receiving end of protests or orders from government or that kind of thing.
And Kate, from PSI's perspective, I think this would be an interesting question.
So the rationale for an NGO to get involved with all you big businesses is always an interesting one and is an ongoing conversation. But I think the first thing is, as I said earlier, we're an NGO that's always looked at the private sector as a force for market improvement. So much of the work we do every day, or the work that my very talented colleagues do around the world, is because of market failure. It's because they're not able to get the drugs, they're not able to get access to the products that they need to live a healthier life. So if we turn that on its head and we actually start to look at our job as a market opportunity generator, as opposed to the solver of market failures, it's very easy to understand the rationale for shared value being important to PSI. There's also just the pragmatism of this. We're an NGO. Overseas development assistance is going down and down and down. And so I'm constantly looking for ways in which we can get other resources to come in and help us create the impact that we need. Alongside that, it was mentioned this morning, the $47 trillion that NCDs are going to take out of GDPs, basically, if we don't get that resolved. But that's 36 million people every year dying of preventable NCDs, things that we can resolve. And so really, given the fact that there is no money out there, if we as an NGO want to have impact, we are working with the private sector and shared value initiatives. 100% of the money that we have so far on NCDs is coming from people like our partners at Eli Lilly, at AstraZeneca, at Novo Nordisk, because essentially they are the ones at the forefront of trying to tackle this problem at the moment. So it's not just about shared value, it's about doing something, essentially, right now for us. And then the third thing is sustainability. Trust me, I am very grateful for the $1 million grant that I get for 1 year. That is fantastic. That is definitely going to get us somewhere. But I'm more excited about somebody coming and saying, let's talk about a business investment for the next 10 to 15 years that's going to be a win-win for us both, and it's going to ensure that there is a market left in that country that the private sector, that we as the private sector can take on, and you, NGO, can go off and solve whatever new problem a market failure somewhere else has created. So pragmatism, sustainability, and just really the fact that it's basically been our core business along the way.
Mehmood and Laurie, you both somewhat covered this in your introduction, but if you'd like to add anything, that would be great.
Very briefly, I'll just, obviously everything circles back to health for us, so anything that we do to support health in a community can reap some rewards, but that's probably even more true in these days, particularly in the United States now that, with the evolution to consumer-driven healthcare. So that's probably where our brand comes in a little bit more, and we see some benefits there, particularly as we expand to more underserved markets, be it in the managed Medicaid or Medicare space. In the international sphere, health insurance is in a very different place, and it's really been pretty fascinating for me because we operate in so many different healthcare environments, and I've been able to see firsthand how our clinical decision-making policies, our coverage policies essentially, can have an impact on the evolution of a healthcare environment. Whether we opt to cover or put restrictions, say, on some kind of cover, ask for clinical criteria to be met before covering something, that sends a message and feeds back into that healthcare environment. And I'm thinking specifically, we do a lot of business in Dubai, for example, and it's a remarkably dynamic healthcare landscape, one where we would 5 years ago have been plucking people out of, in terms of evacuation and moving to a center of medical excellence. Now it's a receiving center for us, so they've really come very far in that very small landscape, but there's still so far to go when you look at the way that that healthcare is practiced and the provider incentives that are in play. So that's just yet another way for us to feed back and try to develop a healthcare landscape by pointing back to evidence-based medicine and bringing the good about healthcare insurance to a new and novel market.
In the interest of leaving time for the discussion around the journey, let me just frame up a question which affects all of us. There are 7 billion people on the planet today. 2050, the estimate is about 9.5 billion people, of which about 7 billion will be living in cities, many of which will be more than 20 million at a time, plus in population. There's 1 billion people hungry today. When the population grows by another 2.5 billion, and we have no green revolution, it's over, folks. Food production per hectare is flat. How are we going to produce 2.5 billion people's worth of food? That's about a 40% increase on the planet. 70% of the planet's greenhouse gases are coming from the agricultural sector. About 70% of the water use is coming from the agricultural sector. About a third of the greenhouse gases are coming from the agricultural sector. If you're in the food and beverage industry, it's not a nice to have. We better figure out. And 10 years ago, we sat down. I joined the company in 2007, less than a year after Inder became CEO and chairman, a physician endocrinologist coming into the food and beverage industry. That itself sounds somewhat radical. But the purpose was very clearly, if we're going to continue to be the leading company that performs and can continue to provide a vital service that affects 100% of humanity, we better figure out a new way of doing it. You know, we'd gotten where we are with the old way of doing business, and we were very good at it. Marketing, distribution, all the rest of it. But let me give you an interesting statistic. The average speed of a truck moving through a megacity today is about 4 to 5 kilometers per hour. That takes about 8 hours to get across the city to do one drop. I don't think that's a sustainable business model, let alone a sustainable environmental problem.
Well said. So the next question I have is kind of a big one. I know that where I sit in my organization in the corporate responsibility function, I have found it extremely challenging to drive the idea of shared value through the organization. So what I'm interested to hear from each of you is, you know, what steps did you take to engage and get buy-in at the senior management level? And related to that, who do you think are the key folks within your organization that need to be engaged and be supportive, whether it's the chief strategy officer, the CFO, your head of marketing? I'd be really curious to hear how you did it, who you got on board, and then also, you know, what challenges did you bump up against? And I know we could be here probably till next Tuesday on that one, but what challenges or key challenges did you encounter, and how were you able to overcome those? And again, whether you have adopted the shared value approach or just adopted a strategy that you had to drive through your organization in order to be able to pursue that strategy. So I think this question probably pertains to every panelist. In the interest of time, I'll ask you to be brief, even though I know it's a big question, and we'll just go down the line. We'll start with Kate.
Okay, so obviously we're a not-for-profit, so I need to have some funding. We don't have a massive R&D budget. I'm overhead, essentially. So the CFO is a very important person for me to be able to speak to and ensure that I have the resources needed. Beyond that, it's really, you know, how are we going to implement these projects? How are we going to bring them to life in countries? So regional directors and country directors, that's 65, 70 different people if I want to do these projects in different countries. And I'm talking to people that are very NGO-focused still. I mean, we're definitely employing new people, but most people still don't have a private sector background. They embrace it, they understand it because of our heritage, but they're used to working with USAID and CDC and PEPFAR, who historically, and apologies to those in the room from those places, historically have always said, you just need to spend down a budget. You don't need to basically make investments and start making money. So this is a different way of working, and ultimately it's a huge mindset change across the entire organization. It can start with the CEO, but if the CEO says it in DC, I'm not sure that's going to be heard in DRC, in a small village where we have a sales manager trying to get this Coartem malarial drug out to somebody and do it from a shared value perspective.
I guess I have come at trying to grow this function in two ways. One is we're in an age, as people often refer to as promiscuous consumers, so that by the time you walk out the door to go to work, you've used between 10 and 12 brands. And so what we see is people moving across brands, and what we also see is, particularly younger folks, as I mentioned, choosing brands because of their social purpose. And so we've been able to zero in on that promiscuousness, honestly, and also on that data to show that good works matters and good works is good for business. At the same time, what we've tried to do also is use existing sort of good works programs and engage employees, and to focus on our employees as consumers, essentially, within the company, and create more dialoguing opportunities. What we've seen at MAC and at Estée Lauder is pro-social programs, basically good for the world programs, are incredible creators of content. And in the age of social media, content creation is very, very valuable, particularly short-form content that can be shared easily, and unbranded content. So if you look at Dove Real Beauty or a lot of the terrific campaigns that have come across, particularly from consumer campaigns. So I think the good news is that there's been a democratization, I think, of news, particularly around companies, and that this democratization is pushing companies towards more good works. I think the challenge is sustainable good works, that don't have a one-year lifespan, because I often feel like a one-off grant does more harm both for the company and for the world than no grant at all. And trying to get sustainable, I would say, programs with realistic metrics. If you have no metrics, you have no chance. I think, though, that metrics need to be very basic, very human impact focused, numbers of meals served, numbers of people housed, very, very, very basic. And then within the company and outside the company, you need to really, from the very beginning, engage in storytelling, particularly around very low cost. We've actually been doing Skype videos of employees across the world. We produced a global video, which our CFO loved, for $9,000. But it was super helpful in showing leadership that employees and customers really do care.
I think part of this is thinking about the time horizon that you want to get a return. If you think about it on a 90-day period, then, as I like to say, you can shut down all of R&D just about, and nothing will happen. And you will get great returns, bottom line will look good. 2 years later, you'll have a problem. Similar possibly with safety and quality and a few other functions. And I look at sustainability in the same way. Short term. And I think given that, organizations, large or small, have sub-functions within our departments or parts of the organization that actually are used to working on different time horizons. I used to run R&D for a large pharmaceutical company, and time horizon for R&D was 10 years. And it was just the norm. The culture is nobody expected. The CEO didn't send a memo and said, give me an R&D report for the last 30 days. Just was not part of the culture. You expect that. In the CPG industry, in the food and beverage, capital investment and supply chain development is a decade-plus part of the culture. So really part of this is taking a look at and saying, where do we have the time horizon? What do people understand? And then translating what we're trying to do as part of that time horizon of the business, of the operationalizing of the business. Once you start to talk somebody else's language, people start to understand what you're talking about. You know, you don't grow a fruit orchard and expect it to bear fruit next year. We know it's going to take 10 years. In the same way, if we do not build the irrigation systems, the infrastructure, et cetera, the water payback is not going to come in the next 12 months. I think the challenge is the expectations of different stakeholders are on different time horizons. And it's up to the job of the senior-most executives to get everybody at least trying to understand how to get onto the same time horizon and the return of why it's critical. Once we did that, and you know that's been a key part of the journey I've been on for almost a decade at PepsiCo, that's a key part. Now, once you do it, it's an interesting evolution in the organization. I can give you examples of sustainability and shared value projects that actually started with our delivery vehicle truck drivers. Because the seed-to-shelf embracement, we didn't have a social cause around a brand. We don't have a social cause around a business unit. This was performance with purpose for PepsiCo. It got translated under that mantra into different business units and comes to life in different ways, but that's the overriding. And we gave it 3 planks. It's very simple. Human sustainability. What is it that we make, the products we make and the composition? I actually led that initiative as phase 1, given my background. Environmental sustainability. Energy, carbon, packaging, water, agriculture. And then talent sustainability. It started off, how are we going to sustain our own employees around this agenda? It has now evolved, and we can talk about it later. System sustainability. And I think companies that are going to get into the next phase are going to move from brand or individual division to actually ecosystem sustainability of systems. Seed to shelf. And that's, in fact, what we're looking at is how do we make that? You start talking about it, people start understanding it. And my view is next 5 years, the leaders will actually be into that. Social responsibility reports will be about ecosystem reports, not company reports. We're one player in the system. I think it would be too arrogant for any one company to think they're the player. In fact, we are one of the components. But we have scale and we have resources that can help shape that ecosystem.
I'll be very brief and just say that I pretty much echo some of the comments that Nancy made about data and metrics, and I would say that that's a big element to getting the buy-in. It really it helps if you have senior management. We have a very unorthodox CEO who's got some great beliefs that trickle down into our same philosophy. So if you can support that with the data and metrics, it helps a lot.
When we developed this second global health partnership that I mentioned earlier, the Lilly NCD partnership in partnership with FSG, one of the very explicit goals of this partnership, and one of the things that made it a shared value initiative, was we believed it would open our eyes to new ways to do our regular business. That was an explicitly stated goal. We didn't know what that meant. We didn't know whether that meant new types of products, new processes, what exactly that it would mean. But that was sort of, we went into it with that mindset. Not long after we launched it, the incident that my younger brother Kyle related earlier when he was talking about Lilly occurred, which is Professor Porter was in a room with a number of executives, including our CEO and the CEO of another multinational drug company, and he asked the question, what percentage of the world's population do you believe have access to your medicines? And that really hit John Lechleiter, our CEO, sort of where he lived. He sat down and did a little back-of-the-envelope calculation and concluded 1 billion, maybe a billion and a half out of 7+ billion people in the world could actually access a Lilly drug, realistically. And so he came back and spoke to our executive committee, and he asked me and the head of our emerging markets business unit to work on developing a new business model that could at least double the number of people who realistically have access to Lilly medicines. See what that would look like. See if it could work. What would it take to do that? Well, it took a lot of work, a lot of effort over time, and we have launched that new business model in China this year, earlier in 2015. And without going into any details, mindful of what Brenda said about this is not about what the programs are, but the gist of it is about bringing our diabetes medicines to the lowest level of the Chinese healthcare system, the community health centers, the township health centers. And you can't do business the same way if you do that. And it's certainly not profitable the way serving other segments of Chinese society are, which is why nobody does it. And we have already got early learnings from this. And the key difference is, and I think this is important to understand, the metric for success here is the number of patients served, the number of patients reached, not the margin on the sale of our products. And so that took, I'm sorry to sort of answer the question, that took leadership from our CEO first and foremost, but it involved our business leadership, not just our corporate affairs group. If it had just been our corporate affairs group, it wouldn't have been seen as business. By partnering with the Emerging Markets Business Unit President, we truly brought all of the business disciplines that the company possesses to the table to develop this new model.
Thanks, Bart. So shifting our focus from the internal to the external, and I'll pose this question to whomever on the panel would like to respond to it. How did you inform your approach from an external perspective? And most importantly, how did you communicate it to your partners, your customers, and your stakeholders? And what was the reaction? Someone would like to take that on? Do I have to call on someone?
I'll start and let you all think about it, which means that no one judges me on my answer, okay? But essentially, so as part of our partnership process, we see it as important to be able to be out there communicating what we're doing with our partners. It's part of the service we offer to say thank you, essentially, but also to try and encourage more to come behind us on this journey. So we have various external things that we're doing. We have an impact magazine. We actually created for the first time last year our corporate partnerships impact report. And in that, we do have some of the metrics and the measurements that we're using in terms of how many DALYs have we generated through shared value and other corporate philanthropy and CSR initiatives. I think the other thing is trying to be part of a community that is pushing the agenda on this. So we are one of the groups, we are one of the members of the International NGO Affinity Group created by FSG and the Shared Value Initiative. There are around 20 INGOs sitting on this now, who get together about 3 times a year and talk about how we as NGOs can actually be better programmed and better thought out in terms of our ways of working on this. And then finally, I mean, it's things like this, just being out here and representing an NGO and not being afraid of the word profit and not being afraid of the fact that we want to work with the private sector, and that we really truly believe that this is the way that we're going to get markets created for opportunities and help our consumers, and we do call our consumers, the access to those products and services that they so richly deserve and need.
Brenda, I will be brief on this one. We were talking at lunch. I think the world's really changed, and the notion that anything that might have a business interest is kind of toxic in the NGO world is just long gone. And not very long gone, but people are very open to talking about.
Depends on the NGO.
Yeah, people are very open to talking about this. Yes, there's clearly a role for philanthropy, and philanthropy is still a critical element here. But understanding that things won't be sustainable, as Cate said, if there isn't a long-term interest by the company that goes beyond just sort of doing good or the whim of the CEO or of particular board members. People understand that, and I think it's a much more receptive world to shared value than it was even 5 years ago.
I mean, I think, one of the things I was thinking about in terms of the panel is sort of what is the problem that we're trying to solve by looking at it through the lens of shared value. And I think the problem that we're trying to solve is someone who, I was fortunate enough to work with George Soros at his foundation, and also I used to work with prisoners living with AIDS, so I've done a lot of time raising money, is that in a very profound way, the math does not work on solving any of the social justice or healthcare related sorrows of the world. And if you look at more recently, I'd say Ebola or AIDS, where actually there is an ability to end an epidemic, the math still isn't working because you don't not only have enough money on the table, but you don't have rigorous enough thinking. And so I think in terms of external call to action, or why should people care about this, or companies doing good, I think that everyone in every room has a cause that they feel very passionately about. And I think that while, for instance, for MAC, if I gave you $17 after you bought a lipstick, you might not give that money to AIDS. You certainly do care that I'm giving it to AIDS, and that means something to you. So I think what we're seeing is more, as part of the world changing, is more an appreciation for collective action. And it's forcing, I think, businesses out of their comfort zone. One of the things that I'm struck by again and again in private-public partnerships is partnerships in life and in business are very hard. We've done partnerships with various government entities. We've done with various international governments, and every single time our time horizon, our culture, is there a point person in that organization, what does it mean if we're 3 months delayed, is very, very hard work. And so I think what you're seeing is companies are willing to invest that work, but I do feel, back to the math not working, is that the real force of all these changes for businesses are consumers, and that this form of consumer activism through social media and through their purchasing power is what is going to continue to push business out of their comfort zone.
I think that's an excellent point, Nancy, and let me just build on the communication side, perhaps make 4 points. One is you can't communicate until you first listen, and you've got to listen to your stakeholders. And I'm not just talking about reading, that's important, meetings are important. But what we did was, some of you may know, Derek Yak used to report to me, he was a member of my staff. I didn't stop there. George Menza was the cardiovascular division director of CDC. I hired him out of the CDC and joined my staff, spent several years. And I can go on. And it was bringing key experts, credible experts who knew their field to join the team. So now you have a dialogue between internal experts and outside experts. You can't be arrogant enough to know that you think, well, we got the answers, let's tell you what we're going to communicate. It's got to start with listening. Consumers, stakeholders, some you got to bring in, either as employees, part of the fold, but really get them engaged. The second, we got better at connecting with NGO, government, universities, etc. I'll give you a number. In the first 5 years, I signed 50 contracts between PepsiCo and outside organizations. That was about 1 every 5 weeks once we got this ramped up. Really started to engage as partnerships. That brought knowledge, thinking, and started to change. And people started listening to our perspective. And then the final part about it is we knew how to market. That's what PepsiCo's sweet spot. But now we had new avenues, the social media, the consumer connectivity. All of this was new muscle that we were going to have to build on top of what we always did. And perhaps something that, isn't brought up yet, but you're always going to have skeptics. And you either accept right from day one that there's going to be skeptics along this journey with you. Some you're going to convince. Some, frankly, don't want to be convinced. And that's okay. It's about the coalition of the willing, then expand on that, add to that, and your communication starts to snowball. And that's what we're finding over time. But you've got to engage your skeptics. That's got to be part of that process. Do you have the courage and do you have the patience to continue on this journey despite the skepticism? Either as an individual, myself moving from one industry to another, Indra Nooyi, who comes in and says, one of her first speeches as CEO and chairman, I'm going to talk about performance with purpose. All of that, you have to have the courage, the conviction, and then stick with it. The most important thing is your own internal employees are listening. Are you consistent? Are your behaviors emulating your message, or is this just a marketing campaign as part of communications? Employees are the first to understand and realize, before your external stakeholders, your own employees will figure it out. And once they figure it out, and if there is not credibility, you've lost them. And if you can't keep your own employees engaged, you aren't going to get anything. So this is very much a multifaceted, and every one of the points I just went through, literally we could spend an hour on each one of these of what it will take.
Sorry, just one other area where I think, and agreeing with Mehmood on this, where there's definitely skeptics, but the world has changed in such a way that about 35% of the USAID grants that we get every year, we're seeing that they want the private sector involved in that. And so it's not as much having to do the external communications anymore. It's actually more about why aren't you doing this, and often with our private sector partners. If you look at the SDGs, the fact that Paul Pullman from Unilever was on the preeminent panel there talking and representing the private sector in the SDGs, and they had a much bigger discussion about it with the private sector this time, I think shows that the conversation has moved on. And whilst the skeptics exist for sure, they're absolutely, I think, also being encouraged to keep talking about it and keep the conversation
But let me
going.
clarify, there are skeptics who are going to question what you're doing. There are also other skeptics that we live with, perhaps more than the NGOs, which are our shareholders. And the shareholder skepticism is on a different thing, and that is it truly going to create value? That's a different sort of skepticism, and I don't think we should confuse the two. Those are two very different things.
So that's actually a good lead-in to the next subtopic I wanted us to cover. A few folks talked about metrics and reporting impact and progress and value. I'd be curious to hear a little bit more about how you're going about doing that. We heard earlier today about the absence of health and health metrics in a lot of the integrated reporting, the indices that evaluate organizations in this space. So if anyone on the panel would like to speak to how are you measuring progress, are those metrics included in your reporting, and how do you show value?
Well, I mentioned in our China project a very simple metric, and it really kind of clarified everything by saying it's the number of people served. Now we have to do it in a profitable way, but profitability is defined as at least one more dollar of revenue than expense, period. But then it's all about the number served. But in our other program, the Lilly NCD partnership, one of the innovations that was designed into that was a framework called Research, Report, and Advocate. The work on the ground, the pilot projects that we're doing in 4 countries is all about the research side. And then we're producing real data that can be reported in peer-reviewed journals and then used, which will tell what worked and what didn't work in developing new ways of serving underserved people, or of providing care to underserved people in the area of diabetes care. And then the advocate piece is using this data to be able to advocate for scaling up what works. Going to the people who really have the money, which ultimately in most countries, most developing countries, is going to be the government, to scale up what works. Don't do what doesn't work. Spend your money on what does work. And so one of our metrics in that program is the number of peer-reviewed journals that our data appears in. That may sound not like a terribly exciting metric, but for us, there's such a dearth of data around what works and what doesn't work in the primary care setting for treating people with diabetes in poorer areas of developing countries that we think that is one of the great accomplishments of this initiative, is to be able to get this data out there. And it's not going to get there if it's just published in white papers that are circulated around inside our company and with our partners. It's got to be in peer-reviewed journals.
So Lori, I think Aetna has a really interesting and unique situation. The contribution to the communities that then translates into reduced healthcare costs. Is that something you measure in any way?
I wouldn't, it's tough to measure that very directly. I would say that's more of an indirect measure. So we come up with, other metrics that are more translatable to the certain project that we're looking at. So, I think that's probably the next step, and that's probably further along the journey towards shared value. If you can really make that direct connection, then it moves out of either philanthropy or, corporate social responsibility, really into the business-driven shared value perspective.
And I think that's where I was going. I think we've talked a little bit about how do you measure this from a social perspective, but I wonder if one or two panelists can talk about the business metric, the health business metric side of it.
Let me take, I think there's the traditional metrics that we can all use relevant to our industry. I can give you examples within PepsiCo very quickly. If we look at our water footprint, we can measure the amount of water used per unit of food or beverage production. That can be audited, we can report it, and we report it. And I can give you numbers that we've had significant progress. In fact, our 2015 goals was to get a 20% reduction. We're actually going to come in 23% reduction compared to 2006. That's almost a fifth less water used, both in absolute terms and in relative terms. And there's lots of other examples. We can look at the business costs, savings, productivity. I would add one caution. If you look at sustainability as a productivity play, it does improve your bottom line. It often will not improve your top line. And to me, the real business impact is when you can continue to grow your top line as a business while not sacrificing your bottom line. You may improve the bottom line, or you may find ways to invest that and actually continue a sustained growth. That might be from your supply chain, it might be from your operations, it might be from your brand, it might be pricing. Lots of ways of looking at it, and we're looking at all of those, and we don't have time to get into those. Just to be controversial, though, let me throw two questions back out at the audience to think about. These are things that I constantly am thinking about. You have to be careful which metric you're using, because not all your stakeholders are on the same page. Let me give you two real examples. In packaging, in any consumer package company, and we're one of the biggest, you have two sorts of sustainable packaging, biodegradable and biocompostable. Biocompostable Great, it disappears, but the carbon is released back into the environment. So if your stakeholders are in the business of reducing carbon footprint and greenhouse gases, they want you to measure that metric. If your landfill advocates are, in fact, your stakeholders, they're going to say, hey, I don't care about it going into the atmosphere. I don't want it in the landfill. Now, I've got to decide which metric do I really go after. I'm not the expert. But believe me, I've asked every expert from MIT down to Miami, across to Stanford, and into Europe, and there isn't a consensus yet. Of course, it'll take several years of discussions and academic papers and all the rest of it. But the fact is, I'm an operating business today. I've got to make a decision as to where to invest. That's the reality between my life as an academic in my former career and where we are today. Be careful with the metric. And one other very quick example, since we're sitting here in Washington. Some of you may or may not realize, but we export ethanol to Brazil. Our cost of ethanol, being subsidized with corn, et cetera, is cheaper, and we export it. The reality of it is, for every liter of ethanol we export, we're actually exporting tens of liters of our aquifer water. So which is better, the agricultural policy or the energy policy? What would you like me to do from an agricultural point of view? Do you understand the dilemma? Which metric should we be measuring? And so my point is for you to think about as we get into these dialogues is we actually even have to get on the same page on what are the right metrics to measure. And when I alluded to the ecosystem impact, I was alluding to this. Because you look at one piece of this puzzle, you're going to come up with a different answer. And the last example is 40% of the water that we extract from the ground today in the United States is actually used to generate electricity. That's from the National Academies of Sciences. So am I trading water for electricity? What do I have a supply of? These are things that we need the dialogue, therefore get the right metric, because once you start measuring it, industry will get behind it. Be very careful what you push us into.
Okay, thank you. So I only have one other question, and depending on how long this takes, and I think it could be quick, we'll then open it up to the audience. So I'm going to ask each of you, if there was one pitfall or one misstep that you could point out so that those in the audience that are thinking about going on this journey could benefit from, what would that be? Bart, why don't we start with you, since Cate always gets stuck going first.
I would say don't underestimate the challenge of explaining the concept of shared value within your company. It is, these things, we're all of us in the private sector are constantly facing challenges around focus, cost efficiencies. I mean, this is just what running a business in America today is all about. And it's very easy for people to say, well, this is just some new gimmicky thing, and it's going to take our focus away from our real business. So and again, we all know, we've talked about here today, there are explanations for that. In fact, there are real reasons to believe that our real business is shared value. But it takes time and effort. Don't underestimate the challenge of doing that.
I'll let you go. Come back.
You know, I think Bart said this over lunchtime, or maybe one of my other fellow panelists. Obviously, we're living and we're operating in a very complex environment. It's already been said. One of the toughest things is how to incentivize and create the right incentives to get the right behaviors. And the biggest challenge is not that we don't have smart people not knowing what to do. It's what we ask them to do. And it's not just overtly what we ask them to do, but what our incentive programs ask them to do. People do what they're incentivized to do. And my biggest question often is, we're asking the same person to execute, operationalize, and deliver, and disrupt themselves. That is emotionally almost impossible. And so how do you get the disruptors in your organization to be incentivized, but allow the operators to then come along on this journey with the right incentive. And I think the balance between the CFO, the head of HR, in my case, the head of innovation, really has to become together. I've seen all too often organizations where everything is articulated, but you look at their incentive structure, you look at the agenda of the CFO, the Chief Personnel Officer, and the Innovation Officer, and they're not on the same page. They may articulate it, but take a look at people's objectives, goals, however it's written in the HR system. I always start there. And I go, I don't care what you're saying, this isn't saying that. 90% of the time, that's what gets delivered. Make sure you spend time in those details. By the way, if my CV was able to list all my failures, it would be several volumes. Yeah, I'm glad it's only thin with the successes.
I would add a little bit to that, is that I think the old days of corporate philanthropy, where they were sort of the folks that no one knew what to do with, but somehow knew the CEO, and they sort of sat in the corner next to HR. And so, no malign on HR. But I think the only way for any of this to work is to be integrated as a full senior partner into the business, which means, as I was saying at lunch, I sit through a lot of discussions about displayers and how toxic or not toxic the displayers are. But I think it's very important to be integrated as a business person, as a business ally, and to make decisions that often might disadvantage your business unit, but would be better for the overall business. And I think until we're integrated in that way as serious business people, we won't be able to really make right decisions either for our units or for the overall business. Clean up batter here.
Does Laurie want to go? I think it's been said before, but this idea of the short-term view versus the long-term view, it's a real mindset change. If you're going to do good business strategy, you've got to be thinking from the long term. And so often people are still coming to us, and I am still going to people with saying, well, we could get something done in the next 6 months, and truly that's really not the way to be thinking about this.